My name is Jaleesa Jenkins. I am a registered nurse. I currently work as a public health nurse for the City of Racine Health Department. I am a mom of 4. I'm married to a beautiful man named Dre, who's a firefighter, and we are both honored to serve our communities. When COVID first hit, I had just become a new nurse. I was in the ICU. I had to learn very quickly what it meant to care for really sick people. It was scary. This was not a situation where I went to work looking forward to my shift. There were a lot of times where there was a bunch of uncertainty whether or not a patient would make it, and most of the time they didn't. At the time, we didn't know what was going to happen and how we were going to care for these patients. So my anxiety was through the roof. A lot of people, a lot of nurses and staff were on edge because you just didn't know what was going to happen. And there were multiple times where we were the last people that these patients saw before they took their last breaths. It took an emotional toll on all of us, but I think we did a good job of banding together and trying to stay positive, but it definitely affected us in a way that we would probably never have imagined. So as a mom, of course, I'm scared. I don't want to bring COVID home to my family. There were multiple times where I would change outfits and scrubs throughout the day. I remember buying a car cover for the seat in our car. I would literally clock out, go to the locker room, shower, change clothes, put my scrubs, my shoes, my socks, my hairnet, everything into like a grocery bag, disinfect everything, drive home, like leave the clothes in the bag outside in the garage. It was crazy. I would jump in the shower again. I was very vigilant. I had young kids at home. And then later throughout the year, we found out we were pregnant with our 3rd child. So I was doing everything I could to take precautions to make sure that I did not bring anything home to my family. My husband also was a firefighter, so he was in the community working as an EMT as well. So he's in small spaces with patients who may or may not have COVID. So we both were really on edge, but we knew that we had a job to do. This is what we signed up for. And we just took whatever precautions we could, and thankfully we're still here. In February of this year, our church, Hope City Church, put together a Black History Celebration Expo. It took place right down the street, Main Project Cafe, and it was basically a community-run event that showcased businesses in the Racine area. There were vendors such as smoothies and clothing, and there were some counselors there. Of course, there were people talking about self-care, and it was kind of like a community rally to say, look, we're sticking together, we're gonna get through this. These are some local businesses that are available and willing to help you cope with whatever you're going through. I was thankful enough to be able to help put that together. And I think even though we still wore our masks and disinfected everything, it was just nice to see everybody together and be able to work through some of those fears. Moving forward, ask questions, get your checkups, figure out what's going on in your body. Self-care and mental health are like buzzwords now. Take advantage of that. There's so many different services that are offered at the health department or at your local doctor's office or even at your local community center that you can take advantage of. Don't let fear overtake you. And I'm speaking as a nurse and as a member of the community. We have to continue to live life, but now we have to do it a little bit more cautiously. Getting your blood pressure screenings, getting your mammogram, cervical checks, blood work done, and talking to your family about what diseases are prevalent. I know in my family there are high blood pressure, there's diabetes, there's obesity. So I have to make sure that I keep an eye on those things. I know when the vaccines were really pressed on people and really encouraged, I know people in my community were very skeptical. And I understood I was skeptical too, even as a nurse. And I believe in medicine. I had my fears, but I thought to myself, I'm gonna do what I think is best. If I get this vaccine and something happens to me, at least I can go to sleep at night knowing that I tried to do the right thing. Ask questions, research, talk to people, and then sometimes it's just trust. We have to put trust into our bodies and trust into medicine that is there to protect us. Moving forward, as we get through this pandemic and whatever else is coming next, take care of yourself. Encompass wellness. Wellness is not just physical or mental, it's also spiritual and emotional. So if you need help, talk to someone, pick up the phone. There's tons of hotlines. The local health departments are there to help you. There's nurses and nurse practitioners and staff that can give you the resources that you need. But let's stay strong as a community.